Hello, I'm Dr. Ruth Roberts, your pet's ally, and happy to be back with you all live today. I've got a couple of things to talk with you about and some other important and exciting for me announcements as well. So we had a couple of questions, one of which I think will tie in beautifully to one of the things I'm talking about. But the first one was from Penny, and unfortunately, Wuji, her Shih Tzu, who is 15, is in stage 4 kidney disease. So her creatinine is 5.9, urine BUN is 124, and phosphorus is 12.5. These are really super high numbers. And generally, these are high enough where this makes the animal feel really pretty awful. So currently, Uji is on KD, Azadil, and a couple of other bits and pieces, including some Entice to help with appetite stimulation. And she sleeps a lot, drinks a lot, pees a lot. She seems to be calm and sort of at peace, if you will, and is aware of her surroundings. So she will still go for some walks and things like that. What Penny's not sure about is if she should try more aggressive treatments, including sub-Q fluids, or just let things be for however long we have. And Penny, I mean, you're at that tough spot. So if Uji will allow you to give subcutaneous fluids pretty comfortably, I would definitely add that in because it's going to help her feel better. It's going to help bind up or flush out the kidney toxins, the phosphorus and things of that nature. And the one other thing I would consider too is if she's eating reasonably well, is instead of the epichitin, probably use something like Alternagel, which is aluminum hydroxide, or Savelamar, which is a medication that's made for people with kidney failure that have really high phosphorus. And the reason this has been useful is that it's a once-a-day dose for dogs. When it's compounded, it becomes less expensive. You don't necessarily have to give it with food because it kind of works all day long, and it's been much more effective at bringing down the phosphorus level. And typically that's when that phosphorus goes up, this is what makes them feel really cruddy. So it creates irritation in the gut, nausea, not wanting to eat, things of that nature. It probably is a marker for some of the other toxins that the kidney produces, and because the waste products are not being filtered out properly. So I hope that's helpful. Quercetin is a great option as well. And if you go to our members area, there is a whole protocol on kidney treatment. So part of what I'm going to talk about today is the next protocol, and probably the last one for a bit. But again, if you head over to our members area, this is what it looks like once you're logged in and you've headed over to the holistic pet health protocols. You can just click on this kidney support protocol, and it's going to give you a lot of these recommendations. So I hope that is helpful. The other thing we want to talk about today is the newest one, which is the allergy support protocol. And the second question I had today was from from Christine, and she was asking about Hunter. Hunter's had allergies for a while. He's a Sheltie. He's sort of middle-aged, and they've gotten to be sort of year-round, and that's just not fun. So, Christine, there's several things you'll want to check out in particular. One is to make sure that Hunter's thyroid is functioning well. And Shelties in particular seem to have an issue with normal thyroid function, and if they've gone from sort of bad to worse, this may be part of the problem. Now, the rest of this will make sense to you too, hopefully, but the goals with allergy control are to modulate the immune system, control the inflammation that's being released, and then decrease histamine circulation. So histamine is the thing that makes you itch if you get stung by a bee or something of that nature. And it has a really important function, but too much of it is pretty miserable. So one of the things, if you know it's something in particular, if it's seasonal, then that can help you kind of narrow in on what you need to work on. If it's associated with fleas, then there's a lot of folks that don't want to use flea medications because they're poisons, and I get it. There's too much of anything is not good, but I think that your dog being comfortable because it has flea allergies and using something. And to me, Seresto collars were the ones that I found to be most effective. I think that is really quite reasonable. So if you're in an area where fleas are a problem, this is what you want to do, is treat the fleas, keep them under control so your pet doesn't suffer. Now, so like many things, if you're feeding a pro-inflammatory food that is highly processed corn, grains, all of that good stuff, start cooking, get veggies in there. That's going to help your pet feel better, and the first step in really reducing inflammation. The other thing I talk about quite often is leaky gut syndrome. And strangely enough, I've had clients where all they did was start probiotics and the allergies were markedly better very, very quickly. So what we're doing there is repairing the gut and getting in organisms that are able to keep the bad guys under control, produce the pro-immune system molecules, and get the immune system to respond more appropriately. So we don't want to boost the immune system here. In fact, that's already the problem, is that the immune system is in hyperdrive and responding inappropriately to allergens that are in the environment. So we want to modulate the immune system and get it to cool down. And one of the best ways to do that is to support the gut. So you've heard me talk quite a bit about that. That's where a rotation and elimination diet can be very helpful, especially when you're using foods that your pet has not eaten in the last 6 months. And it also makes it easier to figure out which foods may be contributing to the allergies. So year-round allergies typically mean one of several things. I shouldn't say two things. One is that it's a food allergy, meaning that because your pet is eating the same thing every day, it's reacting to the same thing every day. And if the other thing is mites, so grain storage mites, dust mites, things of that nature. And then the third thing is mold. So particularly in the southeast, mold is going to be in the environment constantly. The grain storage mites, dust mites are ubiquitous in the environment, and so they are super tough to get rid of. And that's where using allergy testing through Heska is kind of the company I used to use, because they have an oral hyposensitization therapy that will treat for both the mold and the dust mites. So that's an option too. The next step is to reduce inflammation, control the allergic symptoms, and then strengthen the gut. And some of this may or may not make sense, but again, 70% of the immune system is in the gut, and so if your pet's ever taken antibiotics and steroids or some of the other more potent anti-allergy medications, the normal microbiome in the gut has been destroyed. So rebuilding the gut is the place to start. Now, charcoal is in here because as you start to repair the gut, your pet is going to experience die-off, meaning that the bad bugs are dying off, it's going to be uncomfortable. Charcoal helps to adsorb some of those bugs, and it may also help to adsorb a lot of the pollens that your pet may be ingesting. So, dog goes outside, comes back in, the first thing they do is clean their feet, right? So they're ingesting all of the pollen they just walked through outside. So this can be quite helpful. The other big thing there is to ideally wipe your dog's feet every time they come in the door, or as often as possible, and then literally take a damp rag and wipe your pet down at least once or twice a day, both on the backside and then especially on the chest and the belly, because this is where more of this stuff is going to accumulate. Now, fish oil, high doses of omega-3 fatty acids are going to help reduce the itch, help stabilize the histamine granules so that they're not as likely to rupture open and create issues. And then therabiotic powder, that's my preferred probiotic, a really high dose, used daily for 30 days, and then try to go to every other day, provided this is indeed helping your pup. Now, quercetin and stinging nettles. So stinging nettles is a plant that if you brush up against it in the pasture, you're going to get a rash. It's going to create a histamine release. Combined with quercetin, and if you eat nettles though, it reduces the amount of histamine that is circulating in your system. And combined with quercetin, it really has done a fantastic job for many of my patients. So the other thing that is going to be helpful too about quercetin is it does support kidney function and also is a potent antioxidant. So what we've seen in terms of kidney disease is it seems to reduce the deposition of advanced glycosylation end products, or AGE, appropriately, and that prevents scarring of the kidney, but it's more of a long-term solution. Now, curcuma is the active portion of turmeric, and that's used to control inflammation. So if your pet is really red and angry and they've got deep, crusty, uncomfortable skin, this is a great option to use because, again, it's another way to help reduce inflammation. And then these two things may surprise you a little bit. Apple cider vinegar. In practice, I would recommend that people would use it as a spray on local areas. So you'd take an ounce of apple cider vinegar and a half a pint of water and just spray it on the affected area, and then take a walk right away so that your pet doesn't have a chance to lick it off. And then use this after a bath as a leave-on rinse as well. That seems to really help these guys feel better. So that's a great thing to do. So you'd mix up 2 ounces in about a half a gallon of water and then wet it, make sure that it gets down to the skin, and then let it dry on. Let your dog shake off, and then again go for a walk so they don't get to roll in this stuff, in the grass and whatnot, and pick it back up. Now, Selsun Blue, again, this may surprise you. The veterinary shampoos that are designed to treat seborrhea, and that's when the skin gets really greasy and stinky and thick and kind of gross. This does a fantastic job. So the selenium in it seems to help reduce inflammation in the skin. It kills the yeast, it kills the bacteria, and it's really effective at getting the grunge off of the skin. So if you've had a dog that has had this kind of deep, painful, itchy skin, you know what I'm talking about. With any shampoo, suds it up, get it all worked in there. This one does sud lather pretty efficiently, so you do need to use a little bit less, but leave it in contact with the skin for 10 minutes before you rinse off. Many of my patients would use like a calming shampoo afterwards once they got sort of the first layer of grossness off, but many of them found this was very effective. So that may be the only one you need to use. Now, the other things that you can consider are, again, because much of the allergic skin disease is related to leaky gut syndrome, the Gut Instincts GI course, while it sounds kind of weird, actually can be very helpful because it will help you figure out how to set up a rotation and elimination diet and understand what your pet, what's going on in your pet's gut. The other thing you could consider, there are tons and tons of allergy tests out there, and I did a bunch of them in practice. This Pet Wellness Life Stress Scan from Glacier Peak Holistics, it's $108. I mean, I think an allergy test now is at least $300. I have found this to be as effective a roadmap as any other test. And so I would strongly consider it if you're in a situation where all of a sudden your pet's allergies are escalating, if they're starting and you can't get them under control with simple methods. This has been extremely helpful for a lot of my patients. And you can use this to help design your own a rotation and elimination diet as well, because you'll have an idea of what your pet is sensitive to food-wise. So that's another great option. Certainly I can help you with that, with consultation and coaching. So we've got those programs available as well. And then if you've got a quick question, we answer these questions on the Facebook, either videos or lives. And so you may send a question in, but it may take us a week to get back with you about it. But this is where you'll find the answers to them. So you can click right here and get answers to your question. And you can also go to our website, go to the main page, and right on that main page, you're going to see a little button that says Ask Dr. Ruth. So just click on that and fill out the little form that's there, and we'll get you the answer again with the next Facebook presentation that I'm doing. So I hope that is helpful, Terry. I'm glad that that this is useful to you. I also had hoped to have links for you about this, but unfortunately I do not. So we've got an app called iPets Ally, and I'll copy that in here. And I'm sorry I don't have the direct links. It is available currently in the Apple Store for apps. Google Android devices are coming, and what we're doing with this is providing some of the best videos, the videos that you guys have enjoyed the most, as well as blog posts. There's some links to our store. There's the ability to ask a question there, and again, those questions will go to my assistant Melody. She'll get them queued up for the following week's Facebook presentation. So check that out if you've got some time to do that. It's still early. We're going to be loading up more and more information as time goes on. If you find bugs, I'd love to hear about it. Just let Melody know at Dr. Ruth Roberts at drruthroberts.com. And that is what I've got for you this week. I'll be back with a sort of recorded video next week talking a little bit more about the specifics of the app, so you can enjoy that. It'll probably be towards the end of September again before I'll be in sufficient Wi-Fi to broadcast. We'll be spending a lot of the month in Utah in some of the more rural areas. So that's what I've got for you. Have you got any questions I can answer for you right now? I'm always happy to do that live as well. So if so, just pop those in. One of the other big things I'm excited to talk with you about too is I'm going to do a presentation for the Natural Living app, which I'll, again, this is a phone app, so if you go to the Apple Store to Google and download it, and I'll put a link to that in here as well in the comments. But the cool thing about this is you see all these summits, right, with all these healthcare practitioners, and they're free for a certain period of time, and then all of a sudden you've got to pay $50 or $100 or whatever. The cool thing is that this is all free information from many, many different presenters with a wide range of topics. I'm the only veterinarian, so most of them are geared towards human health. But I met a woman named Lisa Duthett when I was doing my presentation down in LA, and she is a medical intuitive and has just been profoundly helpful for me. So there's a great number of people that have all sorts of different takes on ways to achieve health for yourself. So again, I'll put that in the comments below, but click on that link. You can go get the app and get it checked out. But it has been, it's just awesome. And you know, these guys are making this information completely free for you. It will be gradually, you know, each week more and more information will be available for you. So keep checking in on it, because there'll be new stuff all the time. I think my talk will be in November, so that'll be coming a little bit, but do check it out. There's some really wonderful stuff there. So that's what I have for you this week. Until next week, take good care, and remember, your pet's best health starts in the bowl. I'm Dr. Ruth Roberts, your pet's ally.